Hi, Dave with Align Therapy here. Today we're going to talk about my top 3 hip exercises for someone who's dealing with scoliosis. The reason I want to do this video on hip exercises is I see a lot of hip weakness and hip pain in those with scoliosis. Quick story, when I was first practicing, well, not when I was first practicing, I've been practicing for about 7 years. I was an orthopedic therapist. I wasn't specialized in scoliosis at the time, and I had a patient that had hip bursitis, so pain right over the hip bone right here. And she had really bad hip bursitis, and we were trying to strengthen her hip. We were trying to reduce the bursitis as much as we could. She was having injections. She ended up having surgery for it. And what was interesting at the time, I didn't really know scoliosis as well as I do now. And looking back, she had a huge pelvic imbalance because of a lumbar scoliosis curve. She was older, it was degenerative scoliosis. And that hip pain was a result not just of hip weakness, but of the alignment of her pelvis. Her pelvis was shifted so far that it was putting such a load on the IT band and into her bursa that we couldn't really get her bursitis under control because we weren't addressing the scoliosis aspect of that problem. So if we look at treating hip pain in those that have scoliosis, we have to address the scoliosis. So addressing the curve in the low back or the upper back, whatever's creating an imbalance in the pelvis is important to address so that we get good results out of strengthening the hip. So the exercises I'm going to go through today, the 3 exercises, we have to be aware of what the pelvis is doing, and we have to be aware of the alignment of the body. So I'll walk you through those as we go through these 3 exercises. If you have significant pain or anything that's really a significant issue, please consult with a Schroth therapist or a therapist that deals a lot with scoliosis to make sure that these exercises are safe for you. I'm going to demonstrate what we're looking for. You can apply these to some of the other exercises that you're currently doing anyway, that you want to focus more on alignment. So let's get into it. But make sure you subscribe to the channel so you can see other things. So I'm going to do some of these on shoulder exercises as well, and general core exercises. So subscribe and stay tuned for more of these. So the first exercise we're going to do is a single leg deadlift. So with single leg deadlifts, I like to use a kettlebell. It's just easy to hang on to. But the single leg deadlift, you'll notice that all 3 of these exercises are single limb support exercises. So we're supporting ourselves on one leg. The reason for that is as you stand on one leg, we get more activation out of the hip muscles on the side that you're standing on. That's important because that's how we function during the day. We can strengthen the muscles with clamshells and laying on your side and lifting your leg up and things like that, which is fine, but I want more activation out of the hip muscles in standing. So the first exercise is a single leg deadlift. I like to put the weight in the opposite hand from the standing leg. You're going to put your arm in front of you. I'll do this to the side so you can see. Standing on one leg, weight in the opposite hand, a little bit of a bend in the knee, and then you're going to go forward towards the floor and then back up. So trying to keep your back nice and straight, lifting the back leg up behind you, up and down like this. Trying to maintain stability. So now the scoliosis aspect of this. Most people with scoliosis have a shift in their pelvis. Some don't. So if your pelvis is balanced, you don't have to worry as much about this. But if your pelvis is imbalanced, as you're doing this exercise, it's helpful to be looking in a mirror so that if your pelvis is shifted to the side, that you can shift the pelvis back and then make sure that it's staying centered underneath you as you go forward. So as I'm going forward, I can look in the mirror forward. It's a little bit hard to look in the mirror as you get down lower, but we want to keep that pelvis corrected underneath you. Do this on both sides and make sure that your pelvis is centered and that you're not allowing your hip to jut out to the side. Controlling the pelvis, going down into the single leg deadlift, and coming back up. So that's exercise number 1. Great hip exercise. I do that exercise with a lot of my general hip patients anyway. So exercise number 2. In physical therapy, we call this a Captain Morgan. And Captain Morgan, it's a Captain Morgan. So we take the ball, and we're going to put it on the wall. You bring your leg up into this position, and I want the other leg to be far enough away from the wall that you have to push a little bit into the wall with your right leg, with the leg that's on the ball. So the lowest level of this exercise is just maintaining this position. Keep standing on that left leg, pushing into the ball a little bit into the wall. You'll feel activation mostly on that standing leg, and we're getting activation also of the other leg, but more in that standing leg. So then what we do after that is we push into the ball, and we can also move up and down. So adding movement to this works the hip muscles more. And so as we go up and down like this, we're getting more activation. So let's add in the scoliosis aspect of this. As we're doing this, watching a mirror ideally, and trying to control the pelvis in this position so that it's staying centered underneath you. The other thing to look at with this is making sure that while you're doing it, you're not arching your low back, so you're controlling the low back. That might require having someone else watch you at first until you can self-manage that, but we want to control all aspects of the spine as much as we can. This isn't a Schroth method exercise, this isn't scoliosis specific necessarily, but there are things that we can focus on so that we're doing it well, and we're encouraging good alignment of the pelvis and of the spine. The third exercise, let me grab a band here. The third exercise is what we call just standing hip abduction. So we're going to put a band around the ankles, and then you're going to stand. The same thing we're going to focus on as with the other exercises. We're focusing on pelvis balance. We're focusing on to make sure that the hip isn't shifting off to the side. We're centering it underneath the trunk. You can also focus on making sure your pelvis isn't rotated one way or the other. That also happens in scoliosis. So good alignment. Then you're going to stand on one leg and you're going to pull out to the side so that we're working those abductors of the hip. Most people will feel this on their standing leg again. So standing, trying to keep pelvis balance and going out and back. A lot of people will do side-stepping exercises with a band around their ankles. It's totally fine if you can control your pelvis. That's fantastic. So a couple of things that I want you to note with this: if you are doing Schroth method exercises, try and incorporate those into the hip strengthening exercises and try to make sure that you're maintaining some correction while you're doing that. You can maintain some elongation, you can maintain some expansion in the concavities, things like that. So you can make these scoliosis specific exercises, and hopefully you're able to incorporate those. If you have any questions, leave those in the comments. I'll answer those. And it was good showing you these exercises, and we'll see you next time.